The question again, as the president addresses the nation tonight, should he ban or not ban the sale of alcohol? The alcohol industry says it's noted media reports suggesting that government is considering a complete ban on sales in Gauteng. But it says this will encourage the further growth of illicit trade and inter-provincial travel at a dangerous time. Industry players have proposed an approach that includes the current restrictions on the trade of alcohol to the hours of between 10 and 6 from Monday to Thursday. It says on-consumption alcohol premises such as taverns should be allowed to sell alcohol for off-consumption during the third wave. A restaurant should be allowed to serve alcohol subject to a strict curfew. Let's get a different view now from a health perspective. We're joined by Professor Charles Parry, who is from the South African Medical Research Council. He's the director of their Alcohol, Tobacco and Other Drug Research Unit. Thank you for being with us, Professor. Firstly, the overall picture. With the Delta variant, there are warnings now. Do you think, in a nutshell, Gauteng could land up looking something like India did when it was battling this variant?
Well, it's hard to know, but what we are hearing is the Delta variant is more infectious. And certainly people I've spoken to in government are worried about this variant being in the country.
You are a proponent of an alcohol ban, I believe, but a few days ago you were saying it might actually be too late, given what's happening in Gauteng. Why?
Look, I'm not actually in favor of an alcohol ban. I think there are measures we sort of looked at before we got to this point to sort of bring down the pressure on the trauma units and to address heavy drinking, which is also part of the problem with the spread of the virus. So, yeah, I think a ban wouldn't be too late. I think it's too late to think of something like a ban in Gauteng because of porous borders. I don't think in a province like Gauteng that would work. I think other options short of a ban are unlikely to work. You presented the position of the liquor industry that perhaps stopping the on-consumption sales but allowing off-consumption sales so people drink at home. That does sound sensible and certainly more sensible than what's been the case for the last few weeks, where we actually curtailed off-consumption sales but allowed on-consumption to continue fully. But certainly the data that we have, we've analyzed data from the death data and the trauma data from around the country in different jurisdictions. If you impose restrictions on consumption and just allow off consumption, that won't be sufficient to reduce the pressure on hospitals. So the government has to decide: is the goal to save lives through curtailing alcohol sales and thus relieving pressure on hospitals, or is the goal to look at livelihoods? So it's a very difficult situation because there are negatives of both options.
Prof, can you just reiterate there what you're saying will actually work? Because I remember the research looking at one hospital in particular, and scientists there found that not much happened when there was a restriction on the sale of alcohol. There were still incredible trauma cases coming in over the weekend, for example, but what did work was a complete alcohol ban.
That's correct. And I mean, obviously there are things we should have done beforehand to prevent getting to the point where that's the only option. But when we looked at the data from the Worcester Regional Hospital, we found that when we looked at the pre-ban period and the two ban periods last year and the period between the two ban periods and the period afterwards, we found that the partial ban periods were not statistically different from the pre-ban period in terms of bringing down the pressure on hospitals. It was only the full liquor sales ban periods that actually significantly brought down the pressure on hospitals.
Okay, so right now, given the pressure in Gauteng, a ban then would work. But you're saying it cannot only be in Gauteng because there'll just be too much movement. It has to be countrywide.
Correct. I'm glad that's not my decision. But if the goal is to save capacity, and certainly you've interviewed a whole lot of people, I've been listening, but you haven't interviewed trauma doctors and specialists in the hospital in the last sort of 15 minutes. And certainly the position they're giving, and I've spoken to some even today, is the pressures are enormous. It's very difficult for people to find bed space. So a full ban would work in reducing the pressure on hospitals if we look at what happened last year and earlier this year.
Yeah. Even the industry players are saying don't only look at Gauteng, because that'll just lead people to travel to other provinces to go and source their alcohol, and that could lead to problems. What about the alcohol industry saying, though, that a total ban will encourage the further growth of illicit trade? I guess that affects volumes, that increases the hold of these illicit traders, but it doesn't have an impact on trauma wards that you're looking at.
Yeah, that's an issue that has to be addressed in the longer term. And certainly I've looked at the industry reports, and I think they're overstating the position, but it's certainly what you would expect them to do. They're raising this as a huge issue. And certainly the illicit trade is something we need to deal with through things like tracking and tracing on containers. But, it's not the only issue. And as I said, I think it's overstated. And I think, there's no way the illicit trade can emulate the amount of liquor produced by the major liquor sellers. For example, South African breweries has the capacity to put out 2.3 billion litres of beer every year. And certainly even people brewing at home, whatever, there's no ways they can produce that amount of alcohol. So yes, it's something that we have to deal with, but I think it's something that can be left in a month or two's time. It's not an immediate issue, but it's something that we do have to deal with.
Professor, you also deal with tobacco, which we don't talk about much anymore because South Africa moved away from that initial very controversial ban on cigarettes. Do you think it's right that is just gone and forgotten? We don't need to look at tobacco.
Yeah, I mean, tobacco remains an issue, but I think the issues are slightly different. Yes, has been an issue around illicit sales of tobacco, and I think that's far more of an issue around tobacco than alcohol. But certainly, we should be doing all that we can to discourage people from smoking. But at this point in time, I don't think we should be looking at a full ban on tobacco.
Okay, your focus on alcohol mainly, but what do you expect in terms of everything else? Gatherings, presumably, the president has to say people just shouldn't be getting together unless they absolutely have to right now.
I think that's a big issue. We haven't heard enough said about that. I mean, I think we should be looking at gatherings and encouraging people not to meet indoors, not to have gatherings, perhaps more than 10 people. And even if you look at the UK, how they've done it, at one point in time they were saying, don't mix outside your family circle. And then they said, okay, well, you can add one family that you keep seeing, one other group, for example. So I think we need to stop this sort of having people move between multiple groups. I think that's putting a huge risk. And I heard someone say, the issue is catering. It's not people going to work. It's not necessarily, being on public transport. It's people mixing, because we're social animals, social beings. We want to mix with people, and we need to keep that under control and perhaps limit the circle of people who we interact with. Yeah.
When it comes to alcohol, I mean, we once had an approach where restaurants weren't open. They are talking about the huge economic impact there could be if there's an alcohol ban now. But takeaways were allowed, things like that. Do you expect an approach as strict as that?
I don't know. I mean, I could expect the government to say, everything has to close down at 6 o'clock at night. I think we'll get some kind of a hybrid between a sort of a level 3 and a level 4. They may not call it level 3, but it could be level 3 enhanced. I certainly think there will be, some substantial restrictions. I think the situation, is a lot worse than perhaps is sometimes portrayed in the media. I'm hearing cases of people struggling to get hospital space. We look at the data from Gauteng. I looked at it a few minutes ago with, 1,236 in ICU. That's 19% of those hospitalized. That's 1 in 5 are in ICU, and 654 on ventilators. That's 1 in 10 of all those people are on ventilators. And we haven't reached the peak yet. We've probably got another couple of weeks to go. So it's going to get worse.
And as media, maybe we need to reach those hospitals more. I've heard people say, well, show us the pictures of people getting oxygen in the reception certain areas that they're not seeing it. But certainly then we're hearing the data that you're reflecting, that public hospitals are under severe strain. Finally, Professor, I mean, in your mind, does the Delta variant blow all the previous predictions out of the water? There was some hope, in fact, that there would be immunity, especially in the provinces that were hard hit by the second wave. For you, as you look into the future, does it mean now that potentially the sky is the limit in terms of infections in South Africa?
Well, no, I mean, we are vaccinating. We've got to increase that substantially. And certainly what I was, my understanding is that, the Pfizer vaccine is very effective against the Delta variant. And we're looking for more data on the effectiveness of the J&J vaccine. But I think we should have some optimism, but the government's got a very difficult position to please everybody. They're not going to please everybody tonight, but that's what governments have to do. They have to sometimes make hard decisions in order to save lives. And I think that's what they will decide tonight.
All right, thank you very much for your time, Professor Charles Parry, Director of the Medical Research Council's Alcohol, Tobacco and Other Drugs Research Unit.